Alright guys, this is one of my off-the-cuff videos. Today is about neurological disorganization and neuro-emotional technique. When it comes down to it, our emotions play a massive role in our overall health because it directly influences stress and the stress hormones. And the stress hormones, as I mentioned in the adrenal video, have a huge role. Cortisol in a constant state of release in the body is actually really not conducive to overall health. And if you want more information on how, just go watch my adrenals video. But I just want to focus on how to kind of correct these two things. So neurological disorganization is actually a type of miscommunication that the nervous system happens, particularly after a physical trauma. And the reason I'm connecting this with neuro-emotional technique is because it all has to do with our cranial function. And so this is a little bit more of also a structural, just talking point I just want to mention real quick. Because if you've never seen a chiropractor who has worked with cranial bones, then you really need to find one. Because I have been working with patients for 5 years, and the number one thing and first thing I check with every single patient is their cranial bones. Because if there is neurological disorganization going on, if there is what's called switching going on, then your body can be, when being tested by a chiropractor, be giving off false positives. And the reason I'm going to this now is because I've had a lot of patients recently with this. They've had some sort of head trauma, they've had some sort of neuro-emotional or suffering from some kind of post-traumatic stress, which can also cause neurological disorganization. So just making sure that you have that taken care of is really, really important. So finding someone who knows how to check the cranial bones and fix them is super important. And a really good way to self-test, as I said, go back to my self-testing video. If you want to test whether or not your cranial bones are working the way they're supposed to, just simply go through these breathing techniques, which I'm going to do in just a second. But here's why the motion of the skull is so important for this. The motion of the skull happens when we breathe. As we breathe, the skull moves and acts as a pump for our cerebral spinal fluid. There isn't any blood in the brain. It's all the nutrients and detox that happens in the brain happens through the cerebral spinal fluid. So the pump that is the cranial bones pumps through cerebral spinal fluid down the spine and all the way back up to recycle all of that and nutrient the entire nervous system. And another reason why that's important is because we actually have 3 diaphragms. Now everyone knows about the thoracic diaphragm, but few have heard of the pelvic diaphragm or the cranial diaphragm. If one diaphragm is thrown off, they are all thrown off. Because again, it's all about the breathing. As you breathe, you fill up your stomach, the pelvic diaphragm goes down to make more room for the lungs, the thoracic diaphragm goes down to make more room for the lungs, and the cerebral diaphragm moves in order to pump the cerebral spinal fluid. So if this one's not working right, these two aren't working right. So if you're dealing with a pregnancy, having your pelvic diaphragm can be massively, massively important. If you're an athlete or just honestly, just breathing in general is very important for the diaphragm. And again, if that's not working, there's a number of muscles in the low back that also attach there. But anyways, here's how you self-test those. So it's just a few different breathing patterns. So do the same self-testing that I taught you before. Stand straight up, bend over, and see how far your fingers can to touching your toes, and mark that line. Now, with the breathing patterns, it's going to be a deep breath all the way in, and you're going to breathe in even when you think you can't breathe in anymore, and then go down and test. Hold that breath all the way through the test, see how far you can go down. If you fall short of that line, your cranial bones are not moving the way that they are supposed to. Second breath is opposite. Breathe all the way out, then bend over. I will say that doing these tests, it's much easier to do with a partner. And I may not have come out with it yet, but I'm going to have a testing with a partner video to show you how to do that, and we'll be much more efficient, but you're going to test these the same way. The next one you're going to test is called half breaths, quarter breaths. So you take that breath all the way in, and then one tiny breath out. It's just going to be really small one, like, and you'll test those 1, 2, 3. 1 breath out, 2 breaths out, 3 breaths out, bending over between each one. And then the opposite, breathing all the way out, and then 1 breath, 2 breaths, 3 breaths in. Again, testing in between each of those. And then the last one has to do with nasal breath. So first you're going to squeeze the nose, and then you're going to breathe all the way in through your mouth. So bend over, touch without taking another breath. Breathe out. And then plug one nostril. You're going to breathe in through the other nostril during this one. And then you're going to bend over to see how far you get. Again, any of these that you fall short on is a lack of motion in the cranial bones. Another way to test if you have neurological disorganization is these 2 points here, the belly button and here. So what you want to do is you just want to put a rotary motion in these two areas. Once you do that, again, go ahead and self-test. If you go further, there is neurological disorganization. If you fall short, then there's nothing to be done. But if you bend and you go further, the cranial bones need to be assessed. But anyways, I digress. Let's go into the neuro-emotional stuff. So when it comes down to it, I just want to explain real quick that all of the neurovascular points in the body are located on the skull. This is why I talked about the cranial bones first, because before you can really start to address neurovascular and neuromotion, you really need to make sure those are working, because if those aren't working, nothing you do with testing wise here is going to be accurate. So when it comes down to it, I know I'm saying a lot, this is me off the cuff, but our emotions are deeply intertwined to what we do. Now, the nervous system and correcting everything usually will correct this problem, but if you've been through something in your life and you're having to deal with that, then you want to check and see if this is one of those areas. So the quickest way to do that is to start with the neuro-emotional point in the body that's right here. And so all you're going to do is just take 3 fingers, place it right there on your forehead, and you're just going to pull it apart. Pull that apart and then self-test. Again, if you go further, there's neuro-emotional blockage that needs to be opened up. There's a couple different ways in which we want to kind of address this. The first one is straight from neuro-emotional technique. What you're going to do is you're going to, if you can have someone else do it for you, you're going to do exactly what you just did. You're going to find that point right there in the center, and you're going to open it up. And it's best to do this if you're laying down. Again, if you can have someone do it for you, please do. But if not, just open that point up, and what you're going to do is you're going to do a deep dive into what is stressing you out, what is causing your emotions to, be overactive, and just honing in on trying to dig deep and get to the root. What this is doing is it's opening up that point as you're going through those emotions. You may have a well of emotions come up. You may even cry. That's all completely normal. What this is doing is it's helping your body just let it go. Like going into those emotions, digging deep, and then just letting it out. It's really good for the body to have that release. If you ever notice that when you're really upset, you feel a stomach ache. The reason for that, and the tie to this, is this point, the neuroemotional point of the body is also related to the stomach. So when we're stressed, that's what's affected. So that just shows you how it's all tied together. Separate from neuroemotional technique this is just one of many different meditation techniques. I'm going to give you 2 different meditation techniques in order to just kind of help you kind of work through this. The first one is very active. It's called the 7 breaths. So you're going to do 7 different types of breaths, and you're going to do one really fast, one really slow, one really fast, one really slow, one really fast, one really slow. You can also flip that if you want to end in a slow one. I usually do. If you want to go really slow and then really fast and then all the way to 7. So it just looks like this. I'm going to do two sets just to show you how it looks like, but it's just going to go And that's the 7 breaths. So do 7 really quick, 7 really slow. And you're going to do that 7 times. Not 7 each. You're going to do, let's just say we start with slow, so we end on slow. So 7 really slow, 7 really fast, 7 really slow, 7 really fast, 7 really slow, 7 really fast, 7 really slow. 7 breaths. Great way to really let the stress out, getting oxygen to all of the tissues, getting the carbon dioxide out, and really detoxing the body. Great form of meditation. So that is just one of many. As I said, I would always start with the neuro-emotional technique when you're first starting out. Let your body open up that point and let out those emotions. And then if you want to have a daily meditation, the 7 breaths would be one of them that I would recommend. The second one is a self-hypnosis type meditation. So it involves self-talk. And it can be out loud, it can be in the mind. And the same thing with the neuro-emotional technique. I was talking about going through all the things that are stressing you out in your mind while you're opening up that point. It actually would be even better for you if you talk out everything that is stressing you out. If you can find a quiet place alone while you're opening up that point and talking, it's both an active way of letting out that stress all at the same time. But back to the self-hypnosis. So the self-hypnosis, you're going to start with picking an amount of time. Common way to do it is I'm going to meditate for 5 minutes. So what that looks like is you're going to find a nice relaxed position, seated. I recommend something with a back. Let your head relax and just close your eyes and just tell yourself that you will open your eyes in 5 minutes. And then what you're going to do is you're going to start at your whichever one you prefer, whether it's the head or the toes. But you're going to start by, and I recommend that I like the toes. I like working my way up. But you're gonna clench the toes and then let it go. Clench the toes and let it go. And then you're going to clench the feet. You're going to make the muscles fire and let it go. Muscles fire in the feet, let it go. You can move up to the calves, make them fire, let it go. And what I mean by fire is like contract them. Contract the calves, let them go. Thighs, let them go. Clench the thighs, let them go. To the glutes, let it go. Glutes again, let it go. Feeling the low back, the abs, all at the same time. Clench, let it go. Same thing, clench, let it go. Moving to the pecs, let it go. Pecs again, let it go. Clenching the fingers, wrists, forearms, biceps, back, neck, forehead. Clenching everything and letting it go. And once you've gone through that cycle, what you're going to do is you're going to concentrate one-on-one on each of those body parts one more time. And what you're just going to do is you're just going to think about letting that relax, letting that body part one at a time, moving up, starting at your toes, the feet, the ankles, the calves, quads, hamstrings, glutes, abs, low back, fingers, hands, wrists, forearms, biceps, back, chest, neck, everything. One at a time, you're just going to think and concentrate on letting that relax. And then when you're done with all that, you're going to open your eyes. And usually, whatever amount of time that you said it was going to take you to do it, is right when you open your eyes. The body's really good at self-hypnotizing and keeping track of time in the background. Hypnosis is just letting your conscious mind relax while the unconscious mind does all the work. And I know that sounds counterintuitive, but it really works. It's a great way of meditating. But that's all I really have for you for meditation advice for today. One of the things that I learned about early on in my career working with a patient, a rather stubborn one, in terms of helping her get better because she was dealing with she was in a car accident, and she was also dealing with a lot of emotional stuff. And so there's a technique that analyzes injury in relation to emotion. Sometimes when we get injured, our emotion locks onto that and it keeps it from fully repairing. So going through this meditation and going through even injuries that you've been through in the past can help reset the muscles so that they can properly go through the healing process. I know some people might think this is really hippy-dippy, and believe me, I totally get it, but the emotions have a very, very, very powerful effect on the nervous system. And whether or not we treat ourselves positively or negatively directly affects our nervous system and hormonal function. So taking the time to influence our neurology and physiology positively can make a massive difference. And those of you who have suffered from PTSD or suffer from some sort of neuro-emotional issues and stress and loss, depression and anxiety will especially know how much of an impact it makes it. So I hope you find use for this video. I hope you get really good benefits from these meditation techniques. Let me know if you have any other questions.